June is Men's Health Month. It's very important during the lifespan of a man to have a relationship with a physician who knows them as a person, knows what's important for them, and can help them navigate the things that men have to deal with throughout the decades of their life. Interesting kind of facts or things about men's health. Almost a third of men actually don't have a primary care provider. Over a third of men suffer from high blood pressure over the age of 20. A third of them over the age of 20 also misuse alcohol. Over a third of men over the age of 20 are obese. And about 44 million men over the age of 20 are also pre-diabetic. So there are a lot of issues, health issues that affect men that really could be addressed, should be addressed early on, that aren't being addressed because of seeming reluctance on the part of most men to seek health care, and in particular preventive care. So for men over 40 to reduce their health risks, some of the same things for men under 40 apply. So exercise is incredibly important, particularly weightlifting, because as men age, they lose testosterone, they lose muscle mass, and so weightlifting as an exercise is very important. Eating a plant-based diet is also important. Getting plenty of sleep. It's during sleep that your body heals itself. And so getting restorative sleep is really very important as we get older. Obviously, if you smoke, you should quit smoking. If you drink to excess, you should limit the amount of alcohol that you drink. For men, it's up to 2 drinks a day, and women, it's 1, but for men, up to 2 max. And healthy relationships, maintaining healthy relationships and community engagement is also very important for reducing the risk of depression, anxiety, and a lot of mental health issues that occur as men age, primarily as the years go on due to isolation. And so community engagement is really very important. So for men over 40, obviously screening for diabetes, high cholesterol, high blood pressure are very important. For men who were born between 1945 and 1965, they recommend screening for hepatitis C. I also recommend screening for HIV in men who are over 40. Colon cancer screening is also important, and that really should start around 45. The gold standard for that is a colonoscopy, which is done every 10 years. For men who don't want that kind of testing, the least invasive test that we can offer is checking the stool for blood, and then a FIT test, which is checking the stool for cancer cells. And that's kind of the least invasive way for checking for colon cancer, and that's done on a yearly basis. So lung cancer screening is also an important screening tool that we have for men over 50. So if a man has a 20-pack year history of smoking, is a current smoker, or who's quit within the last 15 years, they're eligible to have this testing done, and it's definitely recommended. Screening for prostate cancer for men at high risk, whether if they're African American or there's a strong family history of prostate cancers, can begin at 40. For men at average risk, the screening usually begins at 55, but there's not a strong recommendation for prostate screening. So what I mean is that it's really a conversation you should have with your primary care doctor or your urologist, because it's really a shared decision and a discussion that needs to occur. The way to create change in your patients is to educate them about what they should or shouldn't do. I think most patients know what they should or shouldn't do. I think most patients understand that their choices are hurting them. And it's our jobs as physicians to help them make the change that they so desperately need to make.